Okay, everyone, I'm so excited to dive deep into one of my favorite subjects, how chronic stress impacts the whole you, including your hormone balance. So I asked the experts at the Dutch testing company Precision Analytical, Dr. Debbie Rice, to come on the show to explain about how chronic stress, including over-exercising, can impact your hormones, and a whole domino effect of side effects happens from that, as you all know my story. So thank you, Debbie, for coming on the show today and giving me your time to explain what you do and what we need to do to take care of our whole selves.
Yeah, I'm so excited. Thank you. Thanks for having me today.
So just start with a little bit background on who you are and kind of what your mission is with what you're doing each day and what drives you.
Yeah, so I am a naturopathic physician. I graduated from the Naturopathic University here in Oregon. And the big reason why I became a naturopath is because I wanted to help people, but I wanted to not just be able to say, well, you have these symptoms, do this. Yeah. It was more of, there's something going on, let's figure out why. What are the things that we can do to help improve so that these things don't continue to happen for you? Let's not just Band-Aid approach things. Yes. Let's get to the root cause for you. And so I was lucky enough to find out about the Dutch test. I've been with the Dutch test for about 5 years now. I'm the assistant medical director there. And I also have a very part-time practice here in Portland, Oregon. And so my focus is hormones in general. And I think a big overlay of that is also just looking at day to day how our bodies are dealing with life, right? And so when we look at that, being able to evaluate and support any changes that need to happen to optimize people's health.
For sure. And that's kind of what I was just sharing, my passion and purpose from my own personal experience, but just, really believe in how we need to look at the whole person to make them healthy. And when we're recording this, it's during the coronavirus pandemic. And I feel this strong urge. I've been podcasting almost every day with experts as yourself to talk about why and how we can be healthy and how to optimize our health. And I feel like, hopefully when this calms down in our world, people really understand the priority they need to make of their health, and self-care is what we need to do to become more resilient. And instead of just everyone staying at home, I just feel this need to yell and scream, go, you guys stay at home and take care of yourself. But no one knows what that means.
Right.
I mean, our listeners probably do, but just like, how do we get this out to the world that staying at home, going for a walk outside is just part of the picture? So I call it the holistic method. But why lab testing is so crucial to find what is going on under the hood. As I've said for years, I was healthy, fit, super strong athlete, and then I went downhill, and really feel that it's my mission to help other people avoid going through what I have had happen. But let's kind of back up and talk about hormones and stress and how those are impacted, because not just for stress from over-exercising, but environmental stress, stress from worrying about finances, people out of jobs, all of that.
Yeah, I mean, there's definitely, when we look at stress and the effect of stress on the body, so our body is going to respond to stress as whether it's a good stress or a bad stress. Our body can't tell, oh, this is a good one, that's okay. It just sees stress as a meter, right? So it's going to respond whether it's good or bad. And it's also going to respond whether it's real or perceived. So whether, there's an actual stress on your body, or even if there's mental stress going on. And so being able to understand your stress response is also really important, and how your body can deal or kind of walk through and process that stress is a really big component of self-care. And when I'm talking about self-care, I'm not like, oh, just go to a movie. Like I'm talking about let's roll everything back. When we're talking about self-care, how do you sleep? How do you feel when you wake up in the morning? What are you doing throughout your day? What is that routine that your body is actually supporting in every day? And I think that it can be important to continue testing and evaluating that, because there are these assumptions of health, right? So somebody says, well, I do this certain workout every day and I eat this and I go to bed at this time, I don't think that I have a problem. But if you're having symptoms, and maybe you aren't having symptoms or symptoms that are coming out in a different way, sometimes those things still need to be adjusted because everybody is different based on how their stress response is. So there's like the blanket of like, sure, there are these things that are healthy, but let's dial into you and find out what is best for you.
And that's looking at genetics too, right? I mean, I've noticed, I've been diving into like, why did I have this chronic stress disease breakdown and burnout starting in 2013? That was, you know, probably for years living in with high cortisol, my hormones all out of whack. And then finally, you know, hit rock bottom, that my hormones were all rock bottom. So it's like, you know, how we can thrive when our hormones are over and above what they should be. And then suddenly we don't realize we're killing ourselves by finally being, you know, at the bottom. You're like, oh my gosh, I can't operate anymore. But I think it's creating that awareness of, you know, what is good for you. But the point I was getting to is genetics. Like I was like, why do some people thrive with all that chaos and I could not survive that chaos?
Yeah. I've had some patients say like, well, I don't understand. Like, why is my iron low, for example? And, you know, other people seem to be doing fine. And there's a big difference in what I also call like the bank that you were born with. Right. And so when we look at that, it's looking at, you know, what was happening when your mom was pregnant with you, what was her nutrition status, and then what are the genetics that, you know, are being handed down? What are you gifted with when you are born? And how can you take advantage of all of the different things that you were offered when you were born?
So stress impacts our hormones, and I don't know, where should we start? Like talking about hormones and then talk about what the Dutch test is and how it's different than a urine test to test your, or I mean, it is a urine test, but the difference of blood testing versus saliva testing. I want to get into that a little bit too. So take it whichever direction works.
So with the Dutch test, we have a very specific niche, right? So there's, in the world of functional medicine, there is all sorts of different kind of testing. You can test genetics, you can test stool. What the Dutch test is looking at are your sex hormones. So these are going to be your estrogen, progesterone, testosterone, and DHEA kind of, you know, slides in there too. And the adrenal or stress response. So that is DHEA and cortisol. So that is our very specific niche. And that is what we do. And that's why we're really good at it. What we're looking at there, and the difference with doing something like a blood draw versus the Dutch test is, you know, a serum or blood draw is really great at being able to give you your estrogen level. So you want to know how much estrogen you're making? Great. Let's check an estradiol in your serum. Quick and easy. The difference is with the Dutch test, we also get your estrogen, right? But we get all of the different estrogens that you're making and then what your body is doing with your estrogen. So are you sending your estrogens down the good pathways, the bad pathways? Is your body balanced with your estrogen metabolism? And it also looks at, you know, progesterone, how your body is breaking down your progesterone. Same thing with your androgens or your testosterone and DHEA. Those androgens are those, what we think of like those male type hormones, so testosterone and DHEA. And we want to know how the body is breaking those down. Are we putting them down the potent pathway that really creates high symptoms with that, or are we putting it down the lesser potent pathway? So is it kind of calming that androgen response? And we also look at cortisol. So how much cortisol the body is making, what the body's doing with cortisol throughout the day. And cortisol is that hormone that helps you really deal with stress. So put one foot in front of the other, be able to handle any changes that come up in your life. And when we're looking at all of these, I kind of call these hormones my Goldilocks hormones, because they're happy when they're just right. You know, if we have too much of one thing, body doesn't like it. If we have too little of one thing, the body doesn't like it. So it's a very, very delicate balance between what your body is making for cortisol and its cortisol response and how that's affecting the sex hormones too. And for males and females both, the adrenal or stress response, that cortisol response, can have a really big difference in how those sex hormones are responding. So for females, it can look like changes in cycle, or changes in how your cycle presents itself. Are you having irregular periods? Are you having PMS? Are you having fatigue, sleep issues, those kinds of things? So they're very closely tied.
I'm muting myself because our yard guy decided to show up suddenly. So it's like, I'll keep muting myself when I'm not talking, but it might be loud. So the one thing, you know, our listeners, if there's a lot of people that exercise, and we tend to be those overachievers that are the type A to triple A that think more is better. And I really feel that I'm trying to create awareness that, especially now, for example, with the coronavirus, people are stressed about it. You know, we're not making money, we're out of jobs, people are just panicking. And then they do put an extra load of stress on by trying to exercise more because they can, or they have more time. And then the rest of the year when they're training for races, they're burning the candles, as I wrote in my book, Life is Not a Race, that, you know, you're working full time. I was running my own business, fitness studio for 10 years. And they're trying to fit in their workouts 20 hours a week on top of a full-time job, on top of a family, on top of relationships and friends. So let's like tap into what happens when we're trying to do too much in life.
Yeah. So, you know, the body will try to compensate when you're first doing this, right? Like, all right, like we have this mountain to climb, we're going to get our resources and we're going to do this. And the body gets everything ready to do that, but the body can only do that for so long. Like we don't have an infinite, endless resource of cortisol or, you know, that stress response that can happen without there being deleterious effects. And I will say it's, and these are the sad days when I have, you know, my athletes or people that are really, they take training very seriously, and they should. But sometimes what ends up happening is that conversation of, okay, I'm going to need you to dial back a little bit. And it's really, really hard because a lot of people that are doing that it's also part of their, like that makes them feel good. It's their stress relief. Like that's what they do to deal with stress. And so it becomes really problematic. And for a lot of people, emotional when it's like, okay, we're going to have to work on dialing that back, because what's happening now is it sends your body to the other side, and it is tearing down your body rather than helping to build it up and keep it busy or keep it healthy. And so when we're looking at that, a lot of times it does mean, okay, so when you do your workouts, either you don't do as many of them, or you're not doing 100%, you're doing 70%, or you're doing 50%, because the body can't keep up with that demand. Something has to give. And, you know, for some people, maybe they do have the ability to adjust their schedule. Maybe they do have the ability to change some other things in their life, like work, family, you know, whatever is going on there. But a lot of times it has to do with what the body can stay focused on and how hard it can continue to work.
So many thoughts. You know, I always say that more is not better, less is more. I would say the Goldilocks effect as well.
Yeah.
And I find, I just was saying this morning to my husband, is a good example is that, you know, I've started this path in 2013 with my own health issues from doing exactly what we're talking about, doing too much and racing and too much everything, and cause this imbalance of all my hormones and a whole domino effect. You know, it's just not just, we're looking at the hormones, but as FDN practitioners, we are these health detectives investigating all of you and looking at the why. Like you say, as naturopaths, you know, you're looking at the why and figure out the root causes, and it's never just one thing. And so it's so fascinating as a practitioner now to really look at the puzzle and find the missing pieces of the puzzle and figure out what's going on with someone. But, you know, it is slowing down and not doing as much, and that's hard for us. And I find, I just was saying, you know, I didn't ever really do what everyone told me back then, was to stop training as much. I did because I couldn't, but I wasn't doing what I just was reading an article about. I found out retesting myself recently, I still have H. pylori, and that's causing additional internal stress. So as an example, you know, I'm still trying to bike and run and I feel crappy. I'm like, okay, what's going on? But people have to realize to let your body heal, and whatever protocol you are given, it is recommended just to walk and do yoga. But if you're a triathlete or runner, competitive, you're like, I can't, I don't know how. And, you know, 45 minutes, that used to be like, okay, why bother? Now
Right.
it's like, okay, 30
Yeah.
minutes is all my body wants. But it's really finding, if you want to get healthier and rebuild the whole you, is less is more, and just be patient and
And
figure it out.
a lot of times your body will end up kind of making you shut down,
Yeah.
you know, and that's where we don't want you to get. Like, we want to be able to have you still be very healthy, and we do want you moving and doing all of the things that are healthy for you. We don't want your body to be like, all right, well, I've been giving you all these warning signals, and now I'm just going to have to shut you down. Yeah. And so when we're looking at that, you know, our body, like you said, our body can only handle so many things at one time. Mm-hmm. And with different or other multiple layers of things going on, whether it's other environmental stresses, if you work in certain factories, your body is already being pelted by all of these different stressors. If you do have any other infections, so the body has to work really hard to keep you healthy. And if you have other things going on top of that, it's working even harder. And then when you're pushing more demand for it to work even harder, you know, it's like, oh, just like one more step. And then the body's like, I can't do this. Like, I can't do this anymore. Yeah. I don't have the tools that I need to do what you want me to do. And for a lot of people, not only is that physically a challenge, but mentally and emotionally. So I know that there's a very big mental emotional component to this. And so it is something to address when we're looking at, okay, we have to balance this out, which means we're going to take some of that away from you. That doesn't mean that you have this big void, right? Like, we have to work on creating that good balance for you so that you're not just losing out on everything. It's creating something, a better balance for you, so that it's not just grieving a loss. It's also working through knowing that you're healing your body, knowing that you're doing these things for your body so that you can be strong and continue moving forward in a healthy way.
And exactly what I feel like my purpose is to teach people, you know, don't do what I did, because I did override those red flags and probably like, oh, you know, I'm fine, I can tolerate that much exercise and still work on healing. But 8 years later, you know, look at me now. I still can't race, and I still can't, you know, my big thing I keep talking about to my listeners is that my indication of fatigue and mitochondria damage and hormone imbalance and stress is my running. I can't run. And I used to be a fast runner, and it's just like way too much energy required for my body. And that's my indication, like something is off. And that's why, you know, I redid the labs for myself, and we'll go through my lab just as an example, but just how important it is for people to look under the hood and not say, oh, it's my age. That's my like pet peeve is, oh, I'm getting older. Like, I'm in my 40s, I'm 48, but I'm not 88, you know?
Exactly.
Don't blame age.
Right. Yeah. And I do feel like a lot of people just kind of be like, oh, you know, I'm getting older. Like, you know, I'm just not running as well as I could. And certainly there are other, you know, like sex hormone changes that can also affect that. But if you are a well-oiled machine, your body is going to, you know, it's going to give you warnings of like, hey, maybe we should work on this. Just like you would not, like, in your car that you're taking wonderful care of, right? I know that people use this comparison a lot, but it really is true. Yeah, it really is true. Like, you can't just keep running your car without checking on everything. Oh, you need more windshield wiper fluid. Oh, you need, you know, like, you need an oil change. Okay, so it's checking in with that. Like, what is your body doing? How is it doing? What are the things that we need to do, or that we need to adjust or change or support, or, you know, how can we make your body better, and how can you feel better? I mean, it's also about that too. Outside of this expectation of what your level of health is, we want you to feel healthy too. Yeah.
And I think that is, it is funny because it's always an analogy is your car, but it makes complete sense. And you know, if you're getting your car tuned up, you get oil lube job, and you have to have all the parts in working order for the car to
change your tires.
Level. You know, like the alignment change. I mean, it's so true, but I just don't understand why more people don't do this and take care of themselves as they do their car, or, you know, fixing their house up. It's like, why don't we take care of our whole body? So that's why I feel like with this pandemic going on, that it will drive people to like, okay, am I healthy? Because I wanted to post today on my Facebook, if you got COVID-19, is your immune system strong enough And are you resilient enough to fight it and win? And you wonder why so many people are dying from this. And it makes me think, well, I keep saying on the show that, shows that most people are not healthy, and it's not age necessarily. The older you are, it's anybody who has depressed immune system from probably all of our stressors in life.
Probably like chronic stress. Yeah. I call it like your pillar. Like, what does your pillar look like? Is your pillar cracked and falling apart? Or is your pillar nice and strong and supported? And that's what we're like, when I'm talking about pillar, I'm talking about what are the basics that you do every day to help your body stay healthy. And that's going to be like, how are you sleeping? What's happening with your sleep? When you wake up during your day, how are you eating? What physical activity are you doing? How are you processing stress? Like, are you allowing time for physical activity, for routine eating? Are you hydrating? Like those are just very simple pillars. And then on top of that, and everybody is a little bit different in what they need to keep their immune system running smooth and happy, and just, what works for them. Mm-hmm. And so I know a lot of people will also compare like, well, I look at, my neighbors and they don't seem to need this, or I look at, the moms group that I'm with and nobody else is working as hard as I am, or nobody's as tired as I am. And I will say this, they're probably not telling the truth. Yeah. Like everybody puts on a really good face, right? Yes. But when we really sit down and like, into your body, your heart, how are you feeling? Really be honest with yourself, because when you are talking to providers that are here to help you, we can only help you with the information that you give us. And if you're not honest with yourself, we can't help you do the best that we can to help you feel better. And so I think it really is important to sit down and look at like, okay, like really what is happening for me and how can I make that be better? This is not a place of judgment of like, oh, well, you were doing this before and you're not doing that. Yeah. It's really, okay, you were doing this before. What's changed and what do we need to do to help you feel better and get there?
I just like, gives me chills. It just makes me so fired up and make my eyes water. It's like so many people don't know how they feel. And as a personal trainer that, I was doing for 28 years as my main job. Now this is my passion to do this health coaching, because people didn't know what they felt. They're like, okay, where is that? Do you feel your core working? Are you in your neck and your traps? And I think people are so sympathetic dominant. They don't know how to stop and like be one with their body and feel what's going on inside. So if it's like, after you eat, do you have gas? Do you have bloating? Do you burp? Do you have joint pain or whatever these signs and symptoms of that relate to dysfunction? People are so unaware of it. It's crazy.
Yes. It's, I think it can be quite surprising how many people just kind of disconnect from their bodies, from themselves. Yeah. We're very cerebral. We're very, in our heads and we're, do versus feel. And so I think it can be difficult to, when you ask somebody, well, how does that feel? When you do this, how does that feel? How does your body respond? What's your recovery like? What does that look like? And they're like, And so I think it is important to take those moments of like, oh, okay. Yeah. Like when I do work out, outside of just having it like this routine in your head that you do, and that's how you feel better, like really check in with your body. How are you feeling when you work out? Like, do you have to talk yourself into doing a workout? And if you do, why? What's going on? Once you do your workout or your physical activity, how is your body responding? How long is it taking for your body to recover from that?
Exactly. Yeah, the recovery. So I know I could talk for hours on this subject with you, but the last half hour, if we can go use my lab as an example,
totally.
I'm welcome to share. But I think it's really important for athletes to look at and understand the different, and I keep trying to share this on blogs and talking about the anabolic versus catabolic. How it's that whole Goldilocks effect of every part of our body find balance, find homeostasis. And we have, like you said, it needs to be fine-tuned, that right amount, as well as the body's like an orchestra, and all the players in an orchestra need to be working in synchronicity to create this beautiful music. So how we can find that is look at what's going on under your hood with the Dutch test. And as FDN practitioners, we also suggest doing like a stool test to look at the pathogens, bacteria, because they're going to get us, both tests will give clues, indication to dysfunction, as well as like organic acid test, and we'll look at the Dutch Complete will also give us indication to some other markers of oxidative stress. And I think, you know, looking at gut function, leaky gut, permeable gut wall lining, liver congestion, detoxification, all these building, you know, it's like going back to analogies of a house being built. You have your foundation, you got your structure, and then you have all the nuts and bolts to keep it together.
And they're all important. Every single one of them.
I know. So I'm going to share screen if I can find where it is. So if you guys are watching the video version, if not, we'll just explain it. So I'm just showing the Dutch test, which if you want to explain, it's dried urine, DUTCH stands for.
So the Dutch test stands for dried urine testing for comprehensive hormones. And so it is a dried urine test, which means you do pee on these little strips 4 or 5 times throughout the day. You let them dry, and then you send them over to the lab, and the lab evaluates them. What we get to pull off of that are the sex hormones, so your estrogen, progesterone, testosterone, and the metabolites, or the breakdown of those hormones. We also get to see your DHEA and your cortisol picture. So through all of that and the little tiny thing that you pee on, we get to pull a lot of information.
And a lot of people probably, if you've ever done lab testing with a practitioner, which your traditional doctors are not running these labs. So if you've seen a naturopath, like I saw many people over the years did the saliva test, and that's something you have to drool, and it's really hard to like get all the saliva in your mouth and drool in a little bottle. I found, you know, that's giving you a 24-hour profile, but it's a little different, the urine versus saliva test, but they're both 24-hour picture versus one shot, like a blood test is just one period of that time.
Like that one snapshot in time, where this testing is looking at, we want to look at that circadian rhythm. So when we're looking at circadian rhythm, this is telling us about your sleep cycle, how your stress or your daytime response to stress is happening. So that's what we call that diurnal pattern of your cortisol. So that circadian rhythm, that sleep-wake cycle, we want to see when you're awake, what's happening with your cortisol. Cortisol is your daytime hormone. It's supposed to, you know, shoot up and get you ready for your day, get you started, and then kind of come back down for you to sleep at night. And that's what we're looking for here. We do also, you know, if you are, you know, puttering out some cortisol at night, you can do a nighttime sample too, so we can see, are you having also these little like cortisol spikes at night when you're not supposed to, because nighttime is melatonin's time, right? Melatonin is supposed to take over at night. Cortisol takes over in the morning and throughout the day. So that's what we're looking for here.
I mean, I don't know if we'll have time, but you know, we can talk another time, or I can do a podcast, but how the different waking versus morning, afternoon, at night, if they're out of rhythm, higher, below, that's indication of, you know, nighttime, there's pathogen activity if sometimes the cortisol is higher, correct?
Yes.
And blood sugar dysregulation impacts the morning waking. So the chart we're looking at, this is, I'm on the first page, right? So the first page, you get this great report, and you work with a practitioner to go through it, because if you look at it as a regular person, you're like, okay.
It's like a spaceship.
So you order it through a practitioner, but you can get a good interpretation. Then I, as a practitioner, go through Dutch and talk to the doctors at Dutch to help, you know, give me even more information and really going over the clues that this is telling us about a person's imbalances and areas of opportunity to work on. You can just, this is a summary page. Anything you want to say on here, what we're looking at?
So the first page, as the summary page, is the quick view of like, how are your estrogen, progesterone, and testosterone relative to each other? This does give you, like, your estradiol is your more potent estrogen. So we get to see that here. And we like to see that relative to your progesterone. So how well balanced are they? And then your testosterone. The testosterone is going to be a little bit more further broken down on page 2 and page 3. But we do get a nice picture of the adrenal presentation here as well. So we get a quick look at how much DHEA is being made, how much cortisol is being made with your metabolized cortisol, And then as we shift to the left, we have your free cortisol, so it's free and available for your body to use through the day, as well as the daily pattern. So we're looking at that circadian rhythm or that diurnal pattern of cortisol throughout the day. So this is just that quick look of, okay, how much estrogen, progesterone, testosterone do you have? And then what does that cortisol picture look like?
Okay. And then page 2, we get more into maybe if we should explain what metabolites are used in your urine, the progesterone, the estrogens, and the androgens.
Yeah, so these metabolites are going to be like the downstream markers for your estrogen, progesterone, testosterone, and DHEA. So this kind of dives further into, all right, now we have how much estrogen, progesterone, testosterone you have, and then what does your body do with them? Like where does it go? And this is going to be like your list page. Like if you're a list person, this is your page. What I do like to point out on this page is that about halfway down, like just to the right of your cursor where it says androgens and metabolites, we do have the further breakdown of testosterone for females. So we have your 5-alpha DHT, your 5-alpha and beta androstenediol, and your epitestosterone. So these are important. They're not shown in the picture format on page 3, but they're still tested because they do let us know kind of like the undercurrent of what's happening with your testosterone. So we have your testosterone, but then do you have a good balance of how much you're making downstream? 5-alpha DHT, for example, is a metabolite of testosterone. It can also be a metabolite of DHEA, generally more strongly associated with testosterone, but this metabolite is anywhere from 3 to 10 times more potent than testosterone itself. And so when we look at that, you know, we have your testosterone, right? Depending on your 5-alpha DHT, how strong is that testosterone effect in your body? So if you're pretty well balanced with your 5-alpha DHT and your testosterone, you have a decent balance of how strong your testosterone is. So when you read that testosterone level, it's pretty representative. But if you have a really high 5-alpha DHT, it probably makes your testosterone feel even higher than it looks. Or if you have a low 5-alpha DHT, it can make your testosterone not feel as potent. And so it is important to look at those testosterone metabolites as well.
So, like, obviously my estrogens are below range. So what are some signs and symptoms that people might, if they have below range hormones as estrogen?
Yeah. So when we're looking at estrogen, here's the thing about estrogen and progesterone is that they do have this little fluctuating wave that happens with them throughout each cycle. And we have this really big surge of estrogen that happens right before ovulation. And we have to have that little surge to ovulate, to have that progesterone response. And your progesterone response is there, which is good, which tells me you do get at least enough of a little kick in the beginning part of your cycle to push that progesterone. Yay! But then it starts to peter out in what's called that luteal phase, or the second part of your cycle. So that tells me in general, yes, you're probably getting enough estrogen to eke out that progesterone response, but you don't have enough estrogen to keep that nice, healthy estrogen response later in the cycle. And just cycle-wise, that could feel like fatigue or sleep issues, maybe hot flashes. And in general, the wonderful thing about these sex hormones too is estrogen has also been associated with like lubrication. And so when we look at like your joints and joint spaces, estrogen can be really helpful with how your muscles feel when they're working out and how lubricated your joints feel. So that can also affect like your fatigue, your like joint, like how yummy your joints feel when you're working out.
And I'm also blaming this under eye area to low estrogen.
Yeah.
I read that too, isn't it?
Yes.
I'm like,
So when we look a little bit, and I don't want to say superficial because this is still really important, right? But elasticity of the skin, like estrogen is what kind of plumps everything. So like when we're looking at your skin and like under your eyes and even like on your hands and, you know, your arms, like estrogen is very plumping. So not only vaginally, right? So vaginal dryness can happen when you have low estrogens, but even like other parts of the body, when we don't have as much estrogen, we don't have that same plumping effect on our face, on our skin, our hands, and other places as well.
But then we don't want high estrogen because that leads to all sorts of problems too. So that's what you said earlier. It's this like Goldilocks right amount, that not too low, because I have all these symptoms from low estrogens, and then high estrogens, people have a ton of problems too.
Yeah, yeah. And because that estrogen and progesterone do this fluctuation throughout the month, it can sometimes be a little challenging to like find that right, like, all right, let's catch you where we
Mhm.
want to. And then depending on what's happening for females, if you're perimenopausal at all, so if you're having any fluctuations in your hormones, it becomes even more fun because then we don't have that like expected rise and fall of estrogen. It ends up being a little bit more of, yeah, it's a little bit
Mhm.
unpredictable. And so we do want to support estrogen, but we don't want to support you too much so that we, flip you the other side. And we don't want to suppress anything too much so that we push you too low. So,
Yeah.
yep, is
And
that
that's what
delicate
we
balance.
should add, that women that are still menstrual cycle, they test on days, was it 19 to 20, 18 to 20?
19, 20, 21. So if you're having a normal 28-ish day cycle, we do want to check you around day 19, 20, 21, because that's where we get that other push of progesterone. And that's where we want to see how well does that estrogen progesterone balance look for you in that time.
And this test is for men. Like I'm having my husband, I have an
Totally.
extra kit for him to test because I think a lot of
Totally.
men have low hormones and
Mhm.
testosterone and
Yeah.
all of that, and looking at the big picture. So this
Yeah.
is page, I think we went through all of that, right? And then the
Mhm.
next page is a good, people want to look at kind of the cascade of events that happens and how
Yeah.
hormones, the pregnenolone, how that works to progesterone and DHEA, and how a good example, I think, when you look at this chart is that, if I'm low estrogen, not necessarily just take a bunch of estrogen, that it's,
Right.
look at why we work
Mhm.
backwards and everything in FDN
Mhm.
and nutritional therapy too, is like work your way up,
Yeah. Yeah.
look at the why, peel the layers off. So talk about this
Exactly.
chart.
Yeah. Yeah. So when we're looking at kind of the hormone pathway, or what's called the steroid pathway, so all of these hormones are considered steroid hormones. At least before I used to think steroids like,
Yeah.
testosterone, but steroid hormones include your progesterone, your estrogen, your testosterone, your DHEA, and the steroid hormone pathway all starts from cholesterol. Like all of our hormones are made from cholesterol.
And that's funny
And
because cholesterol people think's bad. And now Cheerios
I know,
commercial, by the way, I was going to
I
say this
know.
yesterday. I have this
Yes.
stupid commercial that's from 30 years ago saying it raises, lowers cholesterol.
Right, right. And
Cholesterol
it's
all you
funny.
need.
We do need cholesterol. We do need those fatty acids. Again, we need them to be healthy. But all of your hormones are going to come from cholesterol. And cholesterol will start to break down. And every cell has a different way that they break things down. So you have certain cells that are going to do more testosterone production. You have other cells that are going to do more estrogen production. So it's not that every cell has the ability to just make estrogen. So everybody in the body, everybody has their own little job. And so when we're looking at cholesterol, your estrogen making cells are going to pull cholesterol in so that they can make estrogen. And they're going to do that through a certain pathway. And pregnenolone is that big, what I call the grandmama hormone, because everything comes from pregnenolone, right? Everything breaks down from pregnenolone. And so that's what we're trying to see in this picture here. Pregnenolone will start to convert into DHEA. And that DHEA breaks down here on the left-hand side of the page. That total DHEA that we saw on that first page drops into DHEAS, and then further down into the androsterone on the right. So that's your alpha pathway. And then to your ethylcholinone on the left, and that's your beta pathway. So the androgens go down an alpha and beta pathway. The alpha pathway is more androgenic, so that means more of those kind of male pattern symptoms, where the beta pathway is lesser androgenic. And I hear a lot of people say, oh, the alpha pathway is bad. You don't want to have an alpha pathway. But it's really about a balance between your alpha and your beta pathway. Because if you have somebody that has, for example, low DHEA and low testosterone, but they're more of an alpha metabolizer, the hope is their body is taking what they have and helping to potentize those androgens, so it may not feel as low. But if you have somebody that's making tons of androgens, you have tons of testosterone, you have tons of DHEA, and they're pushing it down the alpha pathway, that's where it can be problematic. That's where you're going to get those like aggression, irritability, facial hair, acne, body acne, like those kinds of things. That's when we think of a lot of androgens. And depending on the person, receptor sensitivity can make a big difference with that too. You may not have a lot of testosterone. you may not have a lot of DHEA, but if you have sensitive receptors to that 5-alpha, it can cause some of those symptoms of like facial hair and acne. But when we're looking at your presentation here, so your DHEAS, your androsterone, your ethylcolanolone, there's a little fan gauge there that says 5-alpha reductase activity. And that's a good show of what is the balance between your alpha and beta preference. You're leaning a little bit towards that beta, but you're not all the way ticked over into that shaded area of 5-beta. So I would say in general, I'm not too worried about the balance between your alpha and beta. I would say in the future, depending on what happens with your DHEA and testosterone, if your levels come down and you're starting to feel like, ooh, yeah, like I'm just not feeling as androgenic as I was before, we want to look back at that 5-alpha, 5-beta. Okay, great. Do we want to just support those pathways for you? Because you might have a tendency to be lesser androgenic, but it's very mild.
Signs and symptoms of low DHEA, because I seem like this seems like a common pattern in a lot of people, but so my DHEAS is at the low end.
Mm-hmm.
What are some signs and symptoms of low DHEA? Because I think that's what we talked about, the catabolic versus anabolic hormones, the cortisol DHEA ratio is what we look at a lot. So if you could mention anything about signs and symptoms of low.
Yeah, so we have just low DHEA in general is very similar to low testosterone. And that's why I think it's also important to test, because we want to see, is it a DHEA issue? Is it a testosterone issue? Is it both?
Yeah.
You know, where are we wanting to help influence those pathways? But lower androgens in general, especially DHEAS, if we have a low DHEAS, that can also come out as fatigue. But low androgens in general, just kind of not feeling as what I call like that peace of mind, or that like your mental status can also feel a little bit like blah. Mm-hmm. Because a lot of people think, you know, testosterone, sex drive, libido, like they think that. And sure, yes, testosterone and DHEA are part of that. But the other big part of that is like brain motivation, sense of well-being, muscle mass, like your body's ability to balance that muscle mass and fat mass. So that can also feel like people that are not feeling as muscular when they're working out, their recovery might be a little bit different. Sure. Yeah. Their recovery might be a little bit different. So yes, that's part of it.
Yeah, for sure, on a personal level, my challenge is like, I can't lose weight. Not people want to know this, but I'll just use me as an example, because I think it's very common, but like I usually can get muscular, and I again, do not blame the aging process, is looking at, you know, why is are my muscles not as muscular as they were, even if I'm lifting weights even more. And looking at that, but then slower recoveries, like, well, my husband and I do all of our workouts together, but he'll like be fine the next day. And I went for a bike ride yesterday with him, and I pretty much walked like I was so slow. I'm like, what is wrong? Yeah. But it is, that recovery must be slower because you don't have the anabolic, catabolic is more
reserves.
The reserves to build back up.
Yep, exactly. And it's interesting because your testosterone, like we'll see the age-related ranges there for testosterone. So for your age, you're 47. 48. So the age range there is between 3 and 8. Now that said, this is, you know, like in general. So we always want to take into consideration, but how do you feel with these levels where they're at? And so I don't like to look at ranges as, you know, like, this is where it has to be, because everybody's going to be a little bit different on that pendulum. But your testosterone's at 8. That's a pretty good level of testosterone. What I would say is your DHEA is probably not as optimal as it could be. And so even though your testosterone is, you're like, all right, we're here, your DHEA, you know, your PALs and androgen support are not as balanced as they could be.
Now your PALs, you talk about the PALs is like all of this.
Both the DHEA and testosterone.
In nutritional therapy, we taught, our teacher used to say PALs is your pancreas, adrenals, and liver have to all work together. So I like the PALs.
Very true. Yes, totally.
Okay, so this might be a longer conversation, but anything short, we can talk about the estrogens, how they work briefly. This is a whole hour or so itself, but just
yeah.
and something to add in here, I think important to touch on the pathogens or the estrogens and the glutathione and the methylation cycle. And because I was just having my client upload her raw genetic data into Strategene, and looking at her COMT function. And I think, you know, talking about glutathione, and just briefly, I don't know, people can go look at Dutch tests for some webinars and look on YouTube, but this is very complicated, but just something we should know about. Another motivation to test, not guess.
It is. And what we have to remember too is, you know, even though we're testing estrogen metabolites, like, right, we're not a closed system. Mm-hmm. And so as much information as we have on estrogen and estrogen metabolites, those genes can absolutely affect how your body's making and processing your estrogens. The Dutch test is not, it does not test your actual, like, do you have heterozygous or homozygous COMT presentation? What we are testing is the activity of that enzyme. And so I like to stress that, because a lot of people say, oh, well, you know, Dutch tests your COMT activity. We test your COMT activity. And so with that too, we're also checking your CYP activities. And so your estrogens, so we have your E1, E2, and E3. So E2 is that, again, that major hormone that is most active or most robust when you are cycling as a cycling female. We do get like a full picture of your estrogen. So we're not getting just that estradiol. We do see like how much estrone or E1 are you making? How much estriol are you also making? So we do look at a little bit more complete picture of your estrogen. And for you at this time in your cycle, I would actually like to see your E1 and your E2 above those stars, right? Like I want them to be in that luteal range so that we would have a good, more robust estrogen presentation there. Mm-hmm. Because you have a lower estrogen level kind of downstream, we also see lower estrogens expected. But it does tell me that the balance between your estrogen and progesterone tells me that your estrogen could probably be a little bit happier. Just as far as like the amount of estrogen that you have. And so what's that?
I was saying it looks like I'm menopausal, but I'm not there yet.
Yeah, like not quite. And that's the thing, right? Because this is where it gets a little bit tricky. Yeah. Yes, this is where it gets a little bit tricky, because as your hormones fluctuate throughout the month, during certain parts of the month, especially like when you're bleeding or right before you have ovulated, we expect your levels to be in those postmenopausal ranges. But I think a lot of people will look at that and say, oh gosh, she's menopausal. That doesn't mean that you are menopausal. If it's like that all the time, then yes, you are menopausal, but you will have these fluctuations. The question is, how big are those fluctuations? How long are you staying in certain ranges? And that's what we're looking for.
And that's a Dutch test that they offer, right? The 30-day one that you can measure.
Yes, totally.
For 30
the cycle
days to
mapping.
see your entire cycle.
Yes, and that will just check your progesterone and estrogen, but that's what we're looking for, right? Those are the hormones that are going to flux throughout the month. Yes, absolutely. And then the other thing that we're looking at with your estrogens too, with your phase 1 and phase 2 metabolism, your phase 1 metabolism are those CYPs. So that's where we get your 16-OH, your 4-OH, and your 2-OH. And those are going to be through phase 1 metabolism. The dial gauge is here.
People. Mm-hmm. So that's 4-OH, and this is 2-OH, and that's the CYP A1, and this is CYP. P1A,
1B1. Mm-hmm. And then the ester into the 16-OH is the CYP3A4, that blue arrow there. Mm-hmm. And so the dial gauges actually tell me how much of those phase 1 metabolites are going through phase 1. And we can see it's fairly consistent. You are low across the board. But that little pie chart on the right-hand side there, that phase 1 estrogen metabolism ratios, tells me the percentage breakdown of these phase 1 metabolites. So your 16-4 and 2-OH. We have your percentages are actually listed right underneath the pie chart there.
Yeah, 79.8. I need glasses. I can't see either. 6.6% and then 13.6.
And the expected ranges are also listed under there. Yeah. My rule of thumb is that we want to see your 2-OH greater than 60, which you are at 79.8. Mm-hmm. We want to see that 4-OH less than 11, which you are. and the 16-OH less than 30, which you are. So when we look at that ratio, that tells us that your phase 1 metabolism is generally working well. We also see that in the dial gauges of your 16-4 and 2-OH that you're not elevated per se in any of those. So that's consistent. Mm-hmm. And then from phase 1 metabolism, we go into phase 2, and that's where you're going to see that glutathione pathway, that methylation. And so we want to make sure that whatever your body processes through phase 1, you're able to methylate or process well, because if you can't spit it out the end, right, you just kind of get stuck recirculating all of these estrogens. And if you end up, for example, making a lot more 4-OH, that can be more dangerous because those 4-OH metabolites are what can bind to DNA and cause, risk factors for cancer. And we want to lower those risks, right? So if we see that for somebody, we want to be able to support their methylation. We want to be able to support their phase 1 metabolism through different kinds of like phase 1 supports, phase 2 supports, different kind of supplements that can help process those better.
And that's related to people that more at risk for breast cancers, if that pathway is
There's no guarantee. And I will say this, there's no guarantee. Like even people that have really good phase 1, phase 2, there could be other things going on that we're just not able to measure with the Dutch test. But it definitely can, like when we have a high 16-OH or high 4-OH. 4-OH is the bad guy. And that's the one that we also want to look at as well.
Yeah, so we won't go on, but this is seriously 1 hour conversation right here.
Yes.
You're talking about glutathione, detox, and I always say, how do you say that?
The quinone pathway.
Quinone pathway.
Yes.
But that's an important part. So we'll skip through that, but that's definitely something you should dive in deeper once you get your lab tests done for our listeners. But this is another summary page of the urine, daily free cortisol, and the metabolites. We saw it a little bit. The first page gave us the summary.
Yes. And then as we break down here, so we do test everything against creatinine because it is a urine test. And all of your creatinine levels are in range, which is good. What we're looking at here is how much cortisol you're making and the difference between cortisol and cortisone. So our body makes active and inactive cortisol. So, we have to have a gas and brake system for what your body activates or not. And so the Dutch test is looking at not just what's active, but also what is inactive, which I think creates a little bit more of a comprehensive picture, because depending on the person, you might have very low free cortisol, but if you have lots of cortisone, that tells us, okay, your body's still making a lot. It's just not using a lot. It ends up deactivating for certain reasons that could be going on metabolically. And so it is important to look at the active and inactive forms of free cortisol. We also want to look at that total metabolized cortisol, because that's that total production. So are your adrenal glands making enough cortisol? And then of that pool, what is your body using? And so that's what we're looking at here. And so it'll show like cortisol A, B, C, and D, cortisone A, B, C, and D. And those are for the multiple times that you collect throughout the day. So we have, your dinner time sample, your dinner time sample, your bedtime sample, as soon as you wake up, and then 2 hours later. So we're looking at this kind of pattern throughout the day or from nighttime to morning. And that's what the A, B, C, and D are looking at. So the different points throughout the day.
And I am low end of range, which is funny because I think, I started going back and looking at my labs I did since 2013 on this, which were the saliva tests. And, what I've tried to say earlier in other shows is that, you can be high for so long above range. So you don't go normal to low end, you go normal to high. And then after a while, things get dysfunctional and the communication system gets broken between the HPA axis. And so we end up low. But I think I probably was more low than I am now. So I'm hopefully better than I have been because I don't feel so crappy. But I am still low, and that's why I really want to explain this test to people and why you need to test and look at, all your labs and assess it together. But it's what we were saying earlier. Do you want to feel your best? And if you feel like this is as good as it gets, go, okay. What I thought when I saw this results last month is like, all right, I feel pretty good, even though my workouts aren't great as I want them to be, but day to day living life. But just know that, okay, I could even feel better if I had the right tools
Yes.
and protocol to rebuild myself back to optimal. And so I'm thriving at the low end of the range. So why live life when you're at the low end of the range and when you could just strive to be, you know, have that much more vitality?
Absolutely. Absolutely. And I think, you know, and in looking at this, it's also evaluating, okay, how, you know, what are the stressors in your body? Like, is it just physical activity? What is happening for you with your stress for work? What is your family stress? Are there other immune stressors, other environmental stressors? Like, what are those other things that we can look at and evaluate for you so that we can help your body identify and support?
And that's what I keep talking about every show, about these hidden internal stressors that you don't know about unless you do lab testing. So in FDN, Reed Davis claims that hidden stands for hormone, immune dysfunction, detoxification, digestion, energy, and nervous system stands for hidden internal stressors that you have no clue about unless you do various lab tests and correlate all that data together. So we're collecting clues from this test, but it's more like, okay, why am I low when I'm doing all this new stuff in my life, but I'm still low? Well, I just got my parasite test back, and H. pylori, we can talk about another show, is hiding in this lining of my stomach organs. So that's going to be a chronic stress. It's going to cause dysfunction to my gut, my small intestines, and inflammation. It's just a whole domino effect. So it's not just, okay, my cortisol is low, let's take some cortisol supplements and adrenal gland and build that up, because it still doesn't fix the why. And someone, I'll just add, I interviewed yesterday, was saying, you know, it's like you have 5 nails in your foot and you take out 1 nail, you still have 4 nails still in there.
Exactly.
So I thought that was great.
Yes. And that's the thing too, like, you know, supplementation in general can be very helpful, but that's exactly what it is. It is just supplementation. You can never out supplement a poor lifestyle. You can never out supplement other things that are happening in your body, like without addressing them. And so I know that, you know, like I have certain patients that are like, well, you know, I'm doing everything that you told me to, except I'm still, you know, working 70 hours a week.
Yeah.
Okay. Well, like your body is still going to be responding to that. As much as the supplements can help, if we're not addressing the problem, that's an issue. And the other thing too is, I think kind of going back to that body awareness, is there are certain people that are like, well, yeah, but I'm always like this. Like, I'm always like this. And if I see, and if I see, you know, like crazy high cortisol or crazy low cortisol, it's like, well, great, you're always like this, but your body is screaming to me that something needs to change. And so that's where it also looks at, you know, the choices of lifestyle changes and moving forward with different changes. And I know that for some people, you know, you can't run away from your family and you can't quit your job. So yes, there are certain things that we can move and there are certain things that we can't. And so it's looking at what are the negotiables, what are the non-negotiables, and how can we, you know, meet in the middle to help you feel better.
So true. I know that, I keep saying all the time, you can't out supplement poor lifestyle habits and, you know, poor nutrition. And that's what I think I tried to do so many years when I was trying to work on my healing, rebuilding initially, was still try to keep training for an Ironman while I was healing, you know, following these protocols people give me. So I'd blame the practitioners, like, they don't know what they're doing. You know, they're just treating my labs, but it was my responsibility to change my lifestyle. They could give me supplements, but it wasn't working because I didn't change my life enough to just go for walks instead of keep trying to push myself.
Exactly. And, you know, it's not, there definitely has to be this point of being ready to do that. So I know, you know, there are some providers that will have you go through a whole questionnaire of like, are you ready to make these changes? Because if you're not, we're not going to have the best relationship, in the sense of like, you're going to get frustrated because things are not going to be changing. But if you're willing to do these certain things, then we're going to have a great relationship, because that's where we're going to meet and be able to move forward.
I know in FDN, we do have a question, like 7-8 questions I'll ask people, and they have to be motivated on a scale 9 to 10 and understand, you know, this is a 3-month or longer commitment, and you have to be motivated, or else I'm not going to work with you. You know, I'm not just going to take your money and just waste my time and effort, because it's a lot of work as a practitioner, not just the times that we're on a call, but all the work we have to do to dissect and investigate all this information.
Yes, reviewing the labs, being able to, you know, kind of walk through that, compare it to what's going on, and being able to evaluate how it fits into that person's life and what you can do to help support that pathway, I think it does take time. It does take time.
So I know I'm already, do you have a little bit more time? We're already at an hour.
Sure. Yeah.
Okay, just
Yeah.
I'll sum up this page if you could, and then I wanted to finish, we'll finish with the next one and then we're done. But this is a great picture if you guys can watch the video version, but just how the HPA axis works and the connection to the hypothalamus, how it sends a signal to the CRH transmitter to pituitary gland to the adrenal gland. So that's why we used to always call it adrenal fatigue, adrenal exhaustion. That's not adrenals, it's the communication starting from the hypothalamus. And I think, you know, luckily when I published my book, Life is Not a Race, that just was coming out. So I had to go back and edit all the words to say HPA axis, not adrenal exhaustion.
Yeah. Yeah. And that has been a big shift because, and there are still people that look at like, adrenal fatigue 1, 2, and 3. And it does make sense in our minds that like to categorize things. But when we look at the true functionality or dysfunction of what's happening, it really is about that communication from, the brain to the adrenal glands and how the adrenal glands are responding to that. So yeah.
Okay,
and I think in the world of adrenal health, DHEA, I call it, DHEA is a complex hormone because it gets to play in the sex hormone realm as well as the adrenal hormone realm. So DHEA does become quite complex, but we do want to look at that with that cortisol. And what I do like about your cortisol picture here is your DHEA and your metabolized cortisol, that total DHEA and the metabolized cortisol, the noses of your dial gauges are both pointing in the same direction. So you have a good balance between your DHEA and your cortisol. So when we're looking like catabolic, anabolic. But when we look at optimal levels for you, like I feel like your total DHEA could be a little bit better, a little bit higher. I feel like your metabolized cortisol could be a little bit higher to optimize that for you. But you are well balanced between your production of DHEA and cortisol, which is good.
And then we're also looking at melatonin.
Yes.
Coming from the pineal gland, but also we talk about melatonin in FDN as if it's low, it's also an indicator to our gut dysfunction as well, because melatonin is also made in there. And I don't think many people don't talk about that.
A lot of people don't talk about that because a lot of people think, oh, melatonin, the pineal gland, right? But we have a lot of neurotransmitter and melatonin production in our gut. So melatonin can certainly be part of that gut production when we are evaluating melatonin.
Mine's okay. So
and yours is technically in range. I like to see it closer to 30. So, I mean, when looking at like sleep quality for you, that would be a question like, how is your sleep? Are you feeling like well rested? Are you able to fall asleep well? Are you getting enough hours of sleep? So those would be my initial questions when looking at melatonin.
Okay, we kind of went over this already. So then let's finish up on here because I know I want to take your whole day up. This important part of the test, I think, that's included in the Dutch Complete is nutritional organic acids and our neurotransmitter metabolites. Yeah,
so we have a little smattering of these organic acids. And the reason why we chose these is because they're relevant to the Dutch test. So when we're looking at your B12, your B6, your glutathione, these are all about detoxification, right? So this can affect your COMT, this can affect your overall detoxification. And these top 4 markers that are listed as the nutritional organic acids, your B12, the MMA marker, the 2 B6 markers, your xanthuronate and your kynurenate, and then the glutathione marker as the pyroglutamate. All of these are inverse markers. So when they're in range, you have sufficient levels. When you're above range, you have deficient levels. And so when we're looking at your levels, your MMA or the B12 marker is above range. So that tells us we need to get some more B12 in you. And stress will go through B's, vitamin C, like a lot of things. When your body is stressed and doing things, even just normal stress, it goes through a lot of those nutrients. And so when you are low in that B12, that can also affect your adrenal response as well. So, and this B12 is going to be like repletion for this. Like, yes, you can absolutely do the methyl B12, but the adenosyl B12 is going to be also a component of that. So we want to have like a nice mix of B12s to help replenish that for you.
And that's what's funny is that I have been taking B12 and glutathione for a while now, and it just shows that how much you're just saying you use up a ton. And if I have a hidden internal stressor as my H. pylori,
Totally.
who is
Absorption.
sucking up my energy.
Exactly. Yes. Yeah. And so your B6 markers look good, but your glutathione is above range. And who knows, like it could have been even higher before, you know, like in doing any testing. And so this may be a big improvement from where you were before. We don't know.
Why I think it's important to test twice a year, right? Like every, you know, get a protocol and then retest every, 4 to 6 months, or what do you suggest as practitioners?
Yeah, I would say like when you start a protocol, I do like to allow at least 3 to 4 months so that your body can like get that supplementation in. You can make those lifestyle changes. We give your body a fair amount of time to be able to make those changes. If you're feeling like you're moving in the right direction, you could go to 6 months, but I would say between 3 and 6 months, depending on what's happening and how you're feeling.
And the last one, just the dopamine and the melatonin we already saw.
And those are all going to be true to range.
Okay.
Mm-hmm. Yeah, but your dopamine, your epi, norepi, those are nicely in range, which is good. But those are also part of that like stress sleep response. The melatonin, this is just the listed one. We saw the picture on the previous page. And then the very last marker is the oxidative stress marker. This is the 8-hydroxy marker. What this tells us is there anything going on in your body that's contributing to DNA damage or cellular destruction? So it's a general marker. It doesn't tell me that this is happening at this certain location in the body. We don't know that. It would just let us know there's oxidative stress coming from somewhere, and we need to identify what's happening there. Like, is that an environmental stress, or is it because you're not getting enough antioxidant support?
And would that be related to mitochondria function?
Yes.
Like the damage, the oxidative stress would be damage of the mitochondria.
Yeah.
Yeah, so what we do in FDN, I know like what you're talking about is we read like these, you know, acronyms, but the DRESS for Health Success protocol that we work on creating a protocol after assessing all your lab results from, you know, more than just one.
Yeah.
Using the Dutch Complete and then a stool test and maybe an organic acids test for even more information, or a gut, premobile gut test, but then create a DRESS for Health Success protocol stands for D is diet, which I always like to say nutrition. I hate the word diet. It sounds bad history in my world, but diet, rest, exercise, stress reduction, and supplementation. But like, you know, those are 5 things. So we don't like, what you just said earlier is it cannot supplement these other lifestyle factors. So we've got, you know, all these areas are in balance that we need to focus on, not just take, you know, 20 different.
Right. And that's not to say like nutrients, trace minerals, those are all really, really helpful. But if there's something going on that your body can't absorb, like H. pylori, if that's affecting, you know, inflammation and absorption, right? Like your body's not going to be able to absorb those nutrients as well. So it is a multifactorial picture. And it is looking at helping to prioritize what your body can do and how you can influence your body's health and getting better that way.
Yeah. And that's why we have to look at the whole picture, because you have to get rid of that main contributor.
And I do think stool testing, I think, is a really great complement to this, because when we're looking at, you know, phase 1 and phase 2 metabolism, that's just in the liver, right? And so with urine, we can only test so much, but your stool testing is like what I call phase 3, right?
Elimination.
Clearance and elimination. Exactly. And so if your phase 1 and phase 2 are good, but your phase 3 is not, that's going to be a problem. And so we want to be able to look at that big picture, right? So let's get all that information. Dr. Jones, who's our medical director, always says, test, don't guess. And sure, you could look at certain things and say like, well, it's probably this, or it could be this, and we could, you know, implement these certain things. But what if you're not getting that right thing? With testing, we know for sure, and we don't have to guess, and we have that information, and we can move forward confidently with that information.
And then one more question here, are we able to see, you said the liver detox phase 1 and phase 2 detoxification processes, and phase 3 is our elimination process. Where do we see that phase 1 we can tell with the estrogens, and phase 2?
Yes. So that's going to be here on this page 3. So that phase 1 is going to be that CYP. So those CYP 3A4, the 1B1 and the 1A1. So that 16-OH, the 4-OH and the 2-OH and that pie chart, those are all going to be part of that phase 1 metabolism. And then the bottom part of that page is going to be that COMT methylation. That's going to be all that phase 2 metabolism there.
Over here? Okay. So if
Yeah.
people have liver dysfunction in there, if the liver's congested, we can indicate from the oxidative stress marker and maybe collect clues if this is higher or off, out of range, that's indication to liver dysfunction.
Yes. Yes. Now that said, I would say like, it's not going to be your only clue for phase 1, phase 2, but it definitely hints at, okay, yeah, there's probably some liver congestion here with phase 1. Like if you have a high 16-OH or if you have a high 4-OH, there's likely some congestion or things going on in the liver through phase 1 clearance that could be adjusted or supported there.
Okay. Good. Well, thank you. Any questions people have, we can reach out. This is a chart that you can't see because it's sideways, but the steroid pathway, just how confusing all of this is in your hormones
So
and
much.
how important is
So much
cholesterol.
going
And
on.
it's just,
yes,
can't turn it around, but that's a great chart that's included in there. So we'll kind of put everything we can in the show notes, and not my lab test, you don't get that, but just how to maybe get more information about the Dutch test and how you want to get it through a practitioner, because you don't want to just treat results, and really the importance of testing at least one, the Dutch test is our most important one, I think, to start with, and then get some other labs as a stool test, the microbiome testing, and gut organic acid, stuff like that is suggested as well. Do you have any other favorite tests you like to correlate with the Dutch Complete?
So I'll usually do a blood test with some other vitamin markers and thyroid. So that's I call that my triangle of love, right? So we have your adrenal function, your thyroid function, and then your sex hormone. So that my little triangle of love that helps with your energy, your sleep, and blood sugar balance too, because cortisol has a lot to do, is very highly affected by glucose metabolism and all of that as well.
Yeah, so much else to talk. That's
so
one
much
conversation too. But for sure, the full thyroid panel, I think, is not done properly with traditional doctors. And I know so many clients, I have a client that's on 2 different thyroid medications and they're not even doing the full thyroid panel. And it's just like, just really getting a naturopath, functional doctor to work with you to get this full thyroid panel, because it's just, doing the one, what did they just test? The TSH usually.
And sometimes a T4 or a free T4. But yeah, our thyroid does a lot of converting. And so it's good to see like what's happening, not just from, brain to thyroid communication, but thyroid to thyroid hormones and cells, like what's happening in the cellular components for thyroid.
So that could be another follow-up podcast we can do sometime in the future. Is thyroid and a hormone panel, how they're needed and why we need it. So thank you so much for your time. We'll get all the links from you to put in the show notes and see what people can do to learn more how to order the tests themselves. And
absolutely.
So thank you.
Great. Thank you so
Rice.
much for having me.